Heart disease is a leading cause of death. We discuss treatment and ways to reduce or eliminate risk factors. It's all here on the next Latino Motion. Join us.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on Facebook and YouTube. We encourage your comments and contributions for show topics. Funding for Latino Motion is provided by AtlantiCare. For more information, call 1-888-569-1000 or visit atlanticare.org. Atlantic City Electric, energy for a changing world. And South Jersey Gas.
Welcome to Latino Motion, a weekly interview show highlighting issues impacting New Jersey's Latino community while advancing understanding of Latino cultural heritage and contributions to our society. And here is your host, Bert Lopez.
Buenos dias and welcome to Latino Motion. Heart disease is a leading cause of death, with minorities being at higher risk. I'm happy to have Dr. Said Ashraf with AtlantiCare. He's a cardiologist. Doctor, welcome to Latino Motion.
Thank you for having me. It's a pleasure.
And this is your second time on Latino Motion. It's nice to have you back. And for those folks that didn't get an opportunity to meet you the first time, you have such a well-rounded resume that really spans the globe. So I'd like to hear a little bit about how you became a cardiologist and a little bit about your background.
Sure. I started my medical school initial training in Pakistan. That's where I'm from. And I did my medical school there, and then I moved to the United States, where I did my internal medicine residency training in Michigan. I also did my cardiology fellowship there. That's 3 years of each. And then we moved to New York, where I did my interventional cardiology fellowship at New York University. And after that, I joined AtlantiCare, and I've been there for the last 3 years as an interventional cardiologist, and I practice general cardiology and interventional cardiology.
Yeah, so this week is the New Jersey League of Municipalities, and I ran into an assemblyman who just had its stem replacement at AtlantiCare. And before he told me where he went, I said, "You did go to AtlantiCare, right?" He said, "Absolutely, that's where to be." So certainly AtlantiCare has such a great reputation, thanks to a lot of well-qualified individuals like yourself. Now, let's get into the meat of it here in terms of heart disease, a leading cause of death. Tell me more about why it's such a high risk, particularly for minorities as well.
Yeah, as you mentioned rightfully, that heart disease or coronary artery disease is the number one cause of death in the world. And it's in the US, it's also the number one cause of death. We have 20 million people that suffer from coronary artery disease in the US, and at any given time, there's about 10 to 11 people that have chest pains because of heart disease. So that's a very high burden. We spend over $200 billion on heart disease in the US, and that's if you account for health services provided and the loss of work production because of it. So it's quite an economic burden as well. So there's multiple reasons for it. I mean, the heart's a complex, fascinating organ, and a lot of different features to it. So
yeah, we want to get into some of those risk factors, but tell me, when we talk about heart disease, that seems to be like a catch-all phrase, right? Mm-hmm. There's a lot of different type of things that could go wrong. Tell me about some of those various aspects of heart disease.
Multiple different causes can result in heart disease, and that includes, you can have blockages in the arteries, which is called atherosclerosis, which is essentially hardening of the arteries. that cause plaque and eventually restrict blood flow to the heart. And as a result, the heart suffers. The heart has an electrical system to it, and that's the conduction system of the heart. And sometimes there's rhythm disorders in the heart that can cause disease and trouble the heart in that way. The heart has valves in it that help, open and close, allow the blood to flow appropriately to the rest of the body. And diseases of the valves can also affect the heart and then the muscle itself. So it's a complex organ and a lot of different parts to it, and each of them work synchronously. So anytime one of them is not working, then the whole heart suffers.
Tell me, when is it a time to go visit a doctor for your heart? I mean, is there a something like a regular physical you do every time? Is that enough? You're going to getting a regular physical once a year enough to know if you had heart disease or not?
Yeah, I think a yearly physical with your primary care doctor is probably the first step. And depending on your age, then the conversation changes, and we focus more on what the person's age is, and then we look at risk factors. You want to think about what risk factors you have that can lead to heart disease. When we think about heart disease for myself, my main concern is atherosclerosis or blockages in the arteries, because that is the number one. Even in the heart, that's the number one disease. And that forms from risk factors that are often modifiable.
Let's talk a little bit about what we said in the beginning, that minorities are more at risk for heart disease. Tell me a little bit more, and I'm sure some of the risk factors come into play. If you could just explain a little bit of that, and also, is the risk the same for men and women?
So risks are slightly different based on gender. Men are at a higher risk of coronary artery disease compared to women. And as far as ethnicities and racial differences go, ethnicities, especially South Asians, are at the highest risk. And now the ACC has kind of dubbed being South Asian as an independent risk factor for heart disease. People of the Latino community are at higher risk. The risk is anywhere between 8 to 10% of the community has heart disease.
So does genetic come into play? In other words, if my family has a history of heart disease, is there a good chance that it could affect me?
That is one of the reasons, but they actually studied this in 2004, 2000. It was a worldwide study to look at what are the reasons why people have heart disease. And they identified there's essentially 9 risk factors. Some of them are modifiable, and that includes, number 1 is always smoking. Number 2 is high blood pressure, diabetes, high cholesterol. And then there's, lifestyle habits, being obese, not being a very active, sedentary lifestyle, and then not eating good foods, essentially fresh fruits, vegetables, and not eating enough of that in your diet, and eating foods that are not good for your body, like processed foods and fast foods and things like that.
So some of those are lifestyle changes, more of the issue, the cultural habits or norms that can, the way you live your life, that could impact the risk factors.
Yeah, absolutely. And we've looked at these through studies, and we've seen that by modifying these risk factors, you can drastically reduce your risk. If you can exercise, 150 minutes of moderate exercise a week, and that's the minimum. But if you do more than that, that's good for you. If you eat more fresh fruits and vegetables, if you're not, obese, as in you watch your weight, and you're not doing things like smoking or indulging too much in sweets. If you control those things, you can bring your risk down by 40-50%, and that's better than any medication or anything else that can provide you.
So at what point do you see a cardiologist such as yourself?
Well, anytime they want to discuss their risk of how I can help people understand what their risk may be of having a heart attack or having heart disease, and then help guide them in lowering that risk. That would be for somebody who's otherwise healthy. But
so it's not just when you're in the hospital that you have chest pains,
Yeah.
you want to see a cardiologist before that.
Yeah, in the hospital, I'm seeing patients when they're having a heart attack and in doing interventions and stenting and all this stuff. But in the office, I'm often seeing patients to help them
So
understand.
we want to discuss this a little further. We're going to take a quick break. We'll be right back with more Latino Motion.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on Facebook and YouTube. We encourage your comments and contributions for show topics.
Welcome back to Latino Motion. We continue our discussion with Dr. Say Ashraf. He is a cardiologist with AtlantiCare. And doctor, we were talking about some of the risk factors, and you kept saying modifiers, right? So these are risk factors that could be modified, which means that heart disease could be minimized and preventable. Is that correct?
Yeah, absolutely. Just by working on lifestyle, you can reduce your risk by 40, 50% in 4 or 5 years.
That is significant, right?
Yeah.
Let's talk about it. And I know you enumerated those risk factors, but just want to dive a little deeper into them. I think smoking, that's a no-brainer, right? You need to stop smoking. I'm not sure.
Yeah.
And there's help for people. AtlantiCare offers some of that help as well?
Absolutely. It's not easy. I sympathize with people that smoke. It's not easy to quit. Sometimes there's social barriers. Sometimes they're in company with people that smoke. So, I sympathize with them, but there is help out there. The first step is that you have to be ready to quit, to understand that it's not good for you. And then you seek out your primary care doctor and talk to them. And there's different ways. There's behavioral therapy, there's nicotine patches, there's medications that can help you quit. But you just have to be committed.
Is vaping the same effect?
So vaping is fairly new, so we don't know. It's just like smoking. I'm sure you recall back in the 80s, it was a normal thing for everyone to smoke because we didn't understand too much about it. But now you don't see that because there's so much information. So I think in the future, we'll probably see vaping is, if not the same as smoking, maybe even worse.
Now, you mentioned 3 others, such as high blood pressure, diabetes, and cholesterol. Are all those related to lifestyle?
Well, yes, I think so. A lot of our lifestyle and what we choose to put in our bodies and how we treat our bodies ultimately results in what happens to us. There is a genetic component to things like type 1 diabetes, but type 2 diabetes is entirely a lifestyle related disease for the most part. So if you're eating healthier foods, healthier diet, if you're watching your weight, you're exercising, then you kind of avoid these, diseases as well.
So let's talk a little bit about that. Those lifestyle changes. Diet is one of the big ones, right? When you put in your body, could have an impact to increase the risk factors. Is there information on the various type of diets, particularly when we're talking about minorities, and maybe there's some cultural aspects to your diet, ajo con gandules, or something to that effect. What's important to keep in mind when you're adjusting your diet?
Yeah, that's a good question, and it's always challenging because everybody in different cultures eats different foods. But again, that's all has been studied as well, and what we found is that the Mediterranean diet, quote unquote, is the most beneficial and the heart healthy. And it's one of the rare studies that they had to stop early because people that were on the Mediterranean diet were doing so much better than the normal or otherwise what we call the American diet that they had to say, okay, this is unethical to continue studying this because people are doing so much better. And that primarily involves eating more fresh fruits, vegetables, eating more legumes, lentils, chickpeas, things that you can break in half. And, if you think about it, a lot of cultures actually do consume that beans, that's a favorite in our diet. Limiting the amount of red meats and poultry in your diet, no more than a deck of cards per meal. If you can eliminate it, that's even better. Fish is very good. You can include that in your diet as a replacement if you want.
So poultry, that's kind of a new one for me, right? So it's just reducing meat intake altogether, basically, or not eliminated by reducing it.
Reducing it, yeah. If you can eliminate it, good for you. If not, reduce, if you can. Red meat, you should reduce definitely. And choose chicken over red meat. And then, if you can, choose fish over all other types of meats.
Now, we know that we have a crisis basically in terms of being overweight. And this is not just us older individuals, but even the youth. How important is it for parents, for example, to take that into consideration, in terms of the weight of their children and the diet that they should be on?
It's often tough when I get asked this question because a lot of it depends on socioeconomic, condition of the person you're talking to and their access to healthier foods and whether they can afford it. Salad is not cheap. If you may have noticed, it's oftentimes fast food is cheaper than eating a healthy meal. So, that plays a big role, socioeconomic advantages and disadvantages and access to healthy foods. But, overall, I think recognizing that, what you're putting in your body is going to result in bad outcomes is important. We live in the United States where we consume a lot of processed foods. So we have to kind of understand what processed foods is and why it's not good for you. And try to limit it as much as you can, essentially.
You made a great point in terms of the socioeconomics, right? If you can't afford the salad, if you can't afford the produce, and it rely on fast food, obviously, that's what the family has to eat.
Access plays a big role as well.
And I know AtlantiCare is also engaged to help address some of those issues.
Yeah, absolutely. I believe we have a great campaign where we're helping communities through our projects, and so that's good.
Let's talk about exercise. And I think you alluded to that in the last segment in terms of how often you should exercise and considering the age limit, right? If you're in your 60s, how much should you do? If you're younger, how much should you do?
Yeah, so the minimum recommended exercise is 150 minutes a week. And that's for somebody, who's otherwise not doing anything. But the younger you are, the more you want to do. But, that's a good starting point. If you're not doing anything, try to do 150 in a week and then build your way to higher. And that's 150 of moderate level of exercise. That means a level of exercise where you can hold a conversation with somebody. So if you're on a treadmill or rowing or whatever, swimming, well, not swimming, but, on a bicycle, as long as you can talk to somebody, that's considered moderate level of exercise.
And if you could do more, even better.
Yeah, you just start somewhere and then build on it.
Well, there's a lot of new advances in terms of treatment. We want to cover that in the next segment. We're going to take a quick break. We'll be right back with more Latino Motion.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on Facebook and YouTube. We encourage your comments and contributions for show topics.
Welcome back to Latino Motion. We continue our discussion with Dr. Said Ashraf, a cardiologist with AtlantiCare. And We were just talking about some of the really changes you could make. It's very critical to prevent and reduce those risk factors that we discussed. But let's talk a little bit about treatment. And let's start off with recognizing the symptoms that you're having a heart attack or symptoms that someone else is having a heart attack. Tell me more about those.
Yeah, so a heart attack is an emergency. So, you have to recognize the symptoms and uh, seek treatment right away. The most common symptom that people describe is chest pain, sort of an elephant sitting on the chest. They often have shortness of breath with it. Some people may get dizzy. Some people may get nauseous, even start vomiting. But also, sometimes people mistake these symptoms as having an upset stomach because not everyone has typical symptoms that I just described. Some people may have just pain in their jaw or just pain in their left arm. I've even met patients that had pain in their back. But that's why I always emphasize that everyone should understand what their risks are for having heart disease. So the risks that we talked about earlier, if you have those risks and you are having some kind of symptoms that I just mentioned, then you shouldn't take that lightly. You should seek treatment right away just to make sure.
And you described it well as an emergency. So it's something that you shouldn't wait. Time is of essence. Is that correct?
Correct. If you have a blocked artery, that means that area of the heart is not getting any blood. And unfortunately, the heart muscle does not regrow, regenerate. So the area starts dying unless you get intervention. We do one of the highest number of these heart attack treatments at AtlantiCare. So when you come in, that's primarily when unfortunately people will see me sometimes, and I do these procedures to open up these blocked arteries to restore blood flow and improve the heart function again.
Well, you got right into the meat of it in terms of the treatment, because there are various treatments. Obviously, when you have an emergency, utilizing some of those minimal invasive procedures you discuss. I want you to tell me more about that. But there's other type of treatments. There's therapy, there's medication, there's surgery, and then those minimal invasive procedures you discuss. When is the appropriate time for each one of those?
Yeah, there's certainly indication for each one of those. We use medications for what we call stable heart disease, where you do have plaque built up that's chronically been building up for a long time, and now it's starting to cause symptoms. It may limit your exercise tolerance. It may start causing some chest pain, or it may cause shortness of breath. In those patients, we can treat with medications to help you. And if medications don't work, then we take patients to our heart catheterization lab, where we put in things like stents, where we put in small catheters. These are small tubes that go from either the wrist or the groin to the heart. And through that, we can pass these small stents into areas of blockages and open them up. Certainly, if the same patients have multiple arteries with blockages or in locations that are not ideal for stents, then those people are often sent for surgery, open heart bypass surgery, which is also done here. We're in fact the only center in southeastern New Jersey that offers cardiac surgical services.
When you have an emergency, right, is that the first thing you do?
So if you are having a heart attack, then everybody goes straight to the heart catheterization lab, where we do the minimally invasive procedure. We first look at the arteries, and if it's 100% blocked, then we have to open it up, because that's the treatment. And that's how people they improve, and we kind of pull them out of danger. Most of the time it's life-threatening.
And you mentioned that obviously you have a lot of volume that takes place at AtlantiCare, and is this the only place in South Jersey, basically, that does these procedures?
Yeah, in southeastern Jersey, we're probably the only place that's currently doing, treating people that have heart attacks invasively. We even in the state of New Jersey, we do one of the highest volume in terms of numbers of patients that are treated for heart attacks. So we have good experience, and me and my colleagues do this job quite well. We take great pride in taking care of our patients.
Now, obviously, you have an emergency. You go through this procedure that could lead to additional treatment for the future, right? If it happens once, if you have clogged arteries, it's likely that more needs to be done. Is that correct?
Sometimes they have more than one artery that's blocked, and we try to fix those as well. And then once you're stable, you go home. Then you start following up with one of our cardiologists, and then we go back to our risk factors and work on them to prevent these events from occurring again.
Yeah, what kind of role does AtlantiCare play in terms of follow-up, right? You have the emergency. Obviously, there should be follow-up associated with that. Is that something AtlantiCare does as well?
Yeah, absolutely. We follow these our patients very closely. We have a large group of multi-specialty cardiologists within our group that follow these patients closely. We will see them in our offices, and we titrate medications, meaning we make sure they're on the appropriate medicines. We have a great cardiac rehab center at Life Center. So invariably, anyone that has a heart attack or ends up getting a stent, we send them for cardiac rehab, where we go over diet plans with them. They start exercising. We kind of essentially want you to be more active than you were before you had your heart attack or before you had, a stent placed in your body.
Now, before we get to that and have an emergency, right, we want to take those precautionary measures to be able to do the diet, exercise, et cetera. Tell me a little bit more about your office and the type of preventive or treatment that you do in your office.
Yeah, myself and my colleagues, my office is across the street from AtlantiCare in 318 Chris Gropp building. And, I practice general cardiology there, and I see patients for high blood pressure, high cholesterol, coronary artery disease, if you have heart failure, rhythm disorders. And then we have specialists in each of these fields. If you have advanced heart failure, if you have a specialist who's Dr. Siddiqui, who's an advanced heart failure. Then similarly, if you have rhythm disorders that need a specialist, we have excellent heart rhythm electrophysiologist, Dr. Akula, Dr. Link. And we have, a whole team that includes advanced nurse practitioners and PAs that help us, and, they practice independently as well. And we supervise and provide resources.
And the Heart Institute is right across the street, basically?
Correct, yeah. We have offices all over the area.
Okay.
But yeah, my office is right across the street.
Yeah, well, certainly this is great information. And one thing that you would tell people at risk, what's the first step that they should take? Yeah,
so I think the first step anyone should take is they should think of their body as the only car they'll ever get. So if I told you, Bert, that you only get one car for the rest of your life, you're going to take care of that like it's your baby. So, but when it comes to our body, we don't do that. So I think that's how you should look at it, what you put inside it, and how well you take care of it. So exercise, eat healthy, and just follow up with your primary care doctors and make sure that your risk factors are addressed.
That's great advice. Thank you so much for sharing this valuable information with our audience and for being here on Latino Motion.
Yeah, of course, anytime.
Thank you for joining us once again on Latino Motion.
Funding for Latino Motion is provided by AtlantiCare. For more information, call 1-888-569-1000 or visit atlanticare.org. Atlantic City Electric, energy for a changing world. And South Jersey Gas.